But I'd like to welcome from Serene Health OB and Wellness, Dr. Delisa Skeete Henry. She's an
Hi.
and Tatyana Ruddock. She's an advanced practice registered nurse and a certified nurse midwife. And they are part of the dream team who brought my son Miles into existence.
Wow.
So thank you both.
Oh, anytime.
You're welcome. You're welcome.
Today we're going to talk about being pregnant and having a child during this crazy COVID-19 pandemic time. And we're going to talk about what you ladies are doing in terms of home births, which, you know, the show was called Hanging with a Hero. And when I created it a few weeks ago, the premise was I wanted to honor everyday heroes. And if you are pregnant now, it's a really scary time. So what you've done, Dr. Skeete Henry and Tatyana, you'll soon be joining, I guess. You've alleviated some of the nerves of some of these mothers who don't want to come to a hospital, and you've gone to them for home births to make the process easier for them, which I think is remarkable. So let's start with that. Tell me about how that's gone so far for you and how it's helped the patients.
Yes. So what a crazy time. I mean, I never would have imagined that we would be in a state like this. COVID-19 just sort of took 2020 into the record books, I think. So especially for my pregnant moms, we know that this is supposed to be a very special time, a very exciting time. I mean, people are looking forward to welcoming their bundles of joy into the world, and with it being as unstable and a little bit crazy as it is now, it was very nerve-wracking for my pregnant mommies. So what we did, we made a decision to see if we could alleviate some of that stress. And for moms that are certainly low risk and were of the mindset of wanting to deliver at home, we were able to accommodate them. Thus far, we've only done one for the month of April, and we have about 5 or 6 moms that are planning home birth for May. Beyond that, we'll sort of see. We're taking everything sort of one step at a time. So beyond that, we'll see if this is a practice we continue, or we may have to phase out as we get back to our new norm. So,
which is constantly evolving, this new norm.
Yes.
We're on Zoom right now, and we're also simulcasting on Facebook Live, and I have my phone here, so I know that we're going to have a lot of people watching today. So what we're going to do is we're just going to get questions from everybody watching periodically throughout. So if you are watching and you have a question for Tatyana, for Dr. Skeete Henry, I see already people are watching right now. Oh, by the way, my wife says, Miles says, thank you to both of you for delivering. So.
He's talking already? What a brilliant child.
That's all he's talking already because of both of you. It's incredible. Yeah. Wow.
Hilarious.
So please, if you're watching on Facebook, ask questions, because, you know, this is not just a South Florida situation. My brother and his wife, they're 8 months pregnant. So that, you know, in June in New York, they're going to be delivering a baby. So let's spend a little more time on home births, because some people watching might be interested in this. And I know you've already said it's kind of the lower risk. Safety, sanitary, how do you ensure all of those things when you go into someone's home?
So home births have been around forever. You know, I know obstetrics was mainly just home birth based. You know, we've moved it out of the home for the majority of people and brought it into the hospital. But there's still always been a home birth based delivery support, and also out of hospital delivery with birthing centers. You know, again, you have to have a mindset when you're doing a home birth. You have to understand risk and benefits. You know, you don't have the luxuries of getting pain medication on demand. You're going to be planning on doing a completely natural birth. You're not going to be not going to be able to have access to some of the emergency care that we have, and really it's just being able to do a cesarean section. So moms have to realize that. Now, saying that, we know that most home birth transfers are not necessarily for emergencies. 98% probably is for, non-emergent transfer. So wanting pain medication, labor taking too long, rupture of membranes is too long of a time. So again, you have to have that mindset. It's usually reserved for women that are low risk. Low risk moms, may not need all of the intervention that the hospital provides. So it's been around forever. It's going to continue to be around forever. I think the situation we're in now has sort of brought it to light, and women that may not have considered it in the past are now considering it. So
yeah, I was when before Miles was born, I had my baseball glove ready.
If it were only that simple, right?
Yeah.
Oh, now he knows. Now he knows.
After what I saw and what I know.
Yeah.
Thank you both.
Yeah.
That is complicated. There's stuff going on all over the place.
Yeah.
Tatyana, for you, when patients come to see you, there's obviously all the normal questions that go into being an expectant mother, but in these times with COVID, what are expectant moms asking you in terms of their health and their safety and protecting the baby? What kind of questions are you getting?
So honestly, the biggest question right now is, what do I need to do to protect myself and the baby, basically? And we try to push the standard, precautions of washing your hands, wearing the mask, just standard precautions, and just maintain your health, basically, is the information that we're giving these patients. But majority of the patients just want to know, what can they do outside of their normal? And it's just protecting yourself from people and protecting people from you, basically, is what the information.
Social distancing.
Yeah. Sorry for not knowing the medicine behind this, but are pregnant women at a greater risk because of maybe their immune systems or something?
Well, Go ahead, Tatyana.
I say not necessarily. There is theory that pregnant women are at higher risk for certain risk factors because their immune system is a little bit compromised during the pregnancy. But in the case of COVID-19, I think we're all on the same playing field. Granted, the geriatric population and the pediatric population do have the more compromised immune systems. But when it comes to pregnancy, I feel that because our clientele, especially, they're pretty healthy low risk women, they are not at any higher risk than the average person walking in Publix or the supermarket.
So the information is just ever evolving, and I think most people thought that pregnant women would be at more risk, but they're not seeing that. They're seeing that pregnant patients can get the virus, recover from the virus, or get critically ill with the virus, just the same rates of other people. But because moms are pregnant, they're growing this baby. Of course, the anxiety and the concern is always there for especially their baby. So.
And anxiety is obviously not great. Stress is not great if you're pregnant. We are on Facebook Live right now. I see a ton of people are watching. You ladies have fans. Megan, who's watching, says, "The best of the best. Such peace knowing this team is in my corner, delivering with them again in a few weeks." Who doesn't like to hear that? That's wonderful. And I encourage all of you who are watching on Facebook Live, if you have any questions for Dr. Skeete Henry or for Tatyana about having a baby, this is sort of framed around having it now during the COVID-19 times. But while we have these two masterminds, we'll just open it up. If you have any pregnancy-related questions, let's get our money's worth. Right. One of the things with us that we were worried about when we had Miles was babies getting sick because of coronavirus. But look, knock on wood, it seems like that's not been a problem. Does that question come up a lot? Have the two of you been maybe pleasantly surprised that it seems like by and large newborns aren't really affected by this?
Now I can just speak for our population down here. And yes, the data is showing that although moms may be positive, there's not looking to be any vertical transmission where the virus is passed through the placenta and then the fluid and that kind of thing to baby. So our hospital in particular, what they do is they separate mom and baby, and what they're doing is they're testing babies, and babies typically have two tests 24 hours apart, and our babies are negative. And I think, again, not across the board. We're not going to have all of the data until, some time has passed, but they're seeing that there is no vertical transmission at this time. So babies are protected.
For the two of you, I interviewed a doctor last week in New York City, and we talked about the doctors being heroes and the nurses, all the members of the medical community putting themselves on the front lines I know you mentioned that moms are being tested, babies are being tested, but for the two of you to be in a hospital, is this on your mind? I mean, it's maybe even a few weeks ago when it was sort of at its height, how real of a fear was it for both of you to be setting foot in a place where some people around you may very well have had COVID?
I mean, I can say this COVID-19 was real. It was real for me and my family. People, I've had family members in New Jersey that were critically ill, stuck in the hospital for weeks at a time. So it was really real for me, but this is what I signed up for. You know, I can't back away at a time like this because this is what my job is for. It's to protect my mommies and protect our babies and to maintain the health in our community, really.
Yeah.
And the both of you are super calm under pressure. Because I was a first-time dad, freaking out, losing my mind and everything. And the two of you were like cracking jokes.
You didn't show it, David. You didn't show it.
I think I was crying, might have wanted to throw up a little bit. Yeah, but we made it through. But yeah, I want to brag about the two of you a little bit because I was just so impressed. And Tatyana, you said something that the doctor last week said, and I've heard this from a lot of doctors. You have both of you have made this choice as a profession that this is what you do. I mean, this is the oath you took.
Yes.
This is your job to take care of people. So I guess as just a follow-up, do you feel some joy in that you're bringing life into the world now at such a stressful time? When I was thinking about what to ask you both, I thought about the dichotomy of all of the sadness and stress that COVID-19 has brought us, but yet the two of you are on the front lines of joy. So I'll ask both of you that question. Dr. Skeete Henry, we'll start with you. When you deliver a baby and all the news is sad and everything around us is so tragic, I mean, I think it even feels better now.
Yeah, it does. It does. And for that moment when mom is holding her baby for the first time, I think she forgets, she forgets all of it. We see the difference. We see that she's wearing a mask, when typically they wouldn't. We see that she just has her husband there versus like a room full of people or a room full of visitors. We see all of that, but for that moment, it's just mom and baby, and it's awesome. And they're gonna have a story to tell their kids when they're older. It's like I said, it's unprecedented what we're going through right now. But it is a wonderful, wonderful field to be in, and I enjoy it thoroughly.
Are you getting any name requests? Are any children being named Corona or COVID?
No. People joke about it. Apparently in India, I read that there was a set of twins and a mom named them Corona and COVID. So it's documented out there. I'm sure there's more, but it's.
Yeah, you just mentioned it. We're gonna tell our child when he's old enough to understand it that he was born during the time of all this.
Yeah.
Got a question. Do you think this will be the new norm? Will more patients be opting for home births because of the pandemic? And you spoke about that a little bit earlier, but what do you think going forward?
I mean, I think yes. I think the fact that we are normalizing it again is allowing our patients and just the people, the normal community to understand that birth is a process, and it's a process that can be done at home safely. It can be done in a birth center safely. It can be done in the hospital safely. And ultimately the goal is to have a safe delivery and the whole process to be safe. And they're seeing that this can be done. And they're reminded that, regardless of midwife, regardless of physician, OBGYN, we're all putting all hands in deck, and we're doing this for the community, for our patients. We're bringing it back to basics. We're just bringing it back to basics now.
And I think the next step is pay-per-view. Live home births on pay-per-view.
Yeah.
If you're just joining us on Facebook, please keep your questions coming. I'm chatting with two of the best in the business. I am biased, but it's true anyway. They're from Serene Health OB/GYN and Wellness, Dr. Delisa Skeete Henry. She's an OB/GYN. And Tatyana Jack Ruddock. She's an advanced practice registered nurse and certified nurse midwife. And they're joining us here. We're talking about home births, and we're talking about having babies during these crazy times. And this is the perfect time to introduce a baby to this show, whom they delivered 2 months ago. Here he is.
Oh my goodness.
He's sleeping. This is baby Miles, as you two know.
He's huge.
And
Yeah.
What are you guys feeding that
10
child?
pounds now.
duck down a little. There's
Hi, gorgeous. How are you?
Good. It's
Beautiful.
so good to see
Look at
both
the
of you.
cheeks.
I know.
I know.
Oh, you too.
Beautiful.
Look at the cheeks. He's
Thank you so
beautiful.
much, though.
We love you guys so
Yeah.
much.
oh, he's
We love
waking
you.
up.
Yeah.
He's moving around and he's waking up. Yeah.
Never
All
wait
right,
to
bye,
see the
Miles.
baby. Never.
He says goodbye.
You're not enjoying it at all, are you?
I
Oh
know.
my gosh.
Look at his smile. I love it.
Listen, if I have anything to say about it, he's going to be on TV. So this is like a good indoctrination for him. This is his
Yeah.
first TV appearance.
Start him young.
Yep.
Start him young.
Yeah.
Exactly.
Subliminal messages.
Yeah.
Any talent agents watching? Okay, so we have, in the remaining time we have left, again, I'll just open it up for questions on Facebook. There's, plenty of people who have known you. It's funny because I posted this earlier and someone else messaged me just bragging about the two of you. So just know how beloved you are in the South Florida community. What would you, are any women asking you if they should or should not get pregnant now? I mean, I feel like 9 months from now, who knows, we might be back to the new normal, which was the old normal, or some normal in between. But are you getting those questions like, is this a good time to be pregnant? And if you get them, what would you say to somebody?
I mean, I haven't gotten it. Go ahead.
No one's hitting the pause button.
No,
Yeah.
but I haven't necessarily gotten any specific questions about it, but we know when people are shut indoors, we know what's going to happen. We're going to have a post-corona burst, just like our hurricane seasons. We get a lot of conceptions.
Yeah.
So let's see, January, February of next year, we'll see the numbers through the roof.
That is really funny. I hadn't even thought about that.
Yeah.
Oh, that's hilarious. Yeah.
Nothing else to do,
It does make a lot of sense. Yeah. There you go. Wow. All right. It's been an honor and a pleasure chatting with you both. And is there anything else you want to share to anybody watching with regards to managing COVID and Corona and bringing your children around? I know that because I remember asking you a question about my baby and going forward, and you said jokingly something like, "I stop at childbirth." Right? Like, I'm not the expert going forward.
Well, I've realized that parenting is very individual, and what works for me and my kids may not necessarily work for you. I think you take a lot of opinions from family, the pediatrician, but then you just figure it out yourself, and you figure out what works for you guys and Miles, and you'll find that, the next one that comes along, that it may not work for that child. So that's the journey of parenting. So I can give you an opinion, may or may not work. So,
And what advice do you have about bringing babies around family members? And that's been a tricky one for us. Wearing masks. We haven't put our baby in a mask yet, but I don't know. What do you think when people want their family members to see their baby?
I'll let you handle that, Dr. Skeete.
I think that I get that question more than anything. And I think people are just looking for like validation. Again, you have to make that decision. I have some people that absolutely not. Nobody comes to the house, even if it's a grandparent, everything is through a window. And then I have people that are a little bit more liberal. I think you just have to use common sense. Make sure proper hand washing, make sure they're wearing a mask, if they could get tested before, all of those things would give you a little bit more reassurance. But you have to make a decision, personal decision. And, eventually we're going to have to get back to, we're going to have to get back to normal. We're not going to be able to separate from family for forever. So, just one step at a time, essentially.
Yeah,
so,
we're getting there.
Yeah,
Especially here in Florida, probably pretty soon.
Trying.
Yeah. Well,
it's like we're just putting our little toes in the water. That's it, little dip at a time. So it's
as they're
scary.
opening the beaches, that was such a great metaphor.
Yeah.
Yeah. Nice job. Yeah. I can't say goodbye without letting you plug your business. And I'm an endorsement. My whole family is. You want to give a website, a phone number? How can people find out more information about you ladies?
Tati?
Yeah, so our website is serenehealthobgyn.com. We're also on Instagram, Serene Health for You, as well as Facebook. And then you could always find Dr. Delisa Skeete Henry on Facebook. You can find her everywhere. She's all over. She's on the news. She's on the Sun Sentinel.
Okay.
She's doing beautiful things for our practice right now. Beautiful, beautiful things.
So we're a midwifery-based practice for obstetrics. So our belief is that, you know, pregnancy is normal. It's not a disease, you know, so we try to really sort of support women during their pregnancy. You know, we also do GYN. I'm a GYN surgeon as well, you know, dealing with a lot of the GYN problems that women have, uterine fibroids, abnormal uterine bleeding. So we're just very interested in promoting the care of women. So we have four midwives, 3.5. We have Tatyana. Amy Gordon is our brand new midwife that just joined our practice. She's ready.
Awesome.
Erin Gilbert, Imelda Jean-Pierre as well.
And as you said earlier, you might need to hire some more for 9 months from now.
Yeah. Definitely.
You're going to be busy. Well, ladies, what can I say that I haven't already said 10 times? I love you both.
Mm-hmm.
You're the best.
We're forever grateful. Thank you so much.
Thank you. This was fun. Good.
All right. Well, it's called Hanging with a Hero because in my mind, you're both heroes because you're bringing babies into the world. What's better than that? Thank you both so much. And everybody for watching. And we'll have another episode of Hanging with a Hero next Wednesday at 4 p.m. And we'll see you then.